Good afternoon, Greater Sudbury. Mark Gentili here, the editor at Sudbury.com. We're back with another live chat with an official here in Sudbury, an elected official here in Sudbury. I want to thank Mayor Brian Bigger for joining us this afternoon once again. Mr. Mayor, thanks for your time.
Thank you very much for the invitation again, Mark.
It was a big news day today. We saw the projections both from health officials, public health officials in Ontario, and from Premier Doug Ford himself this afternoon, talking about the statistical modeling that has been done and the projections that the government's working on in terms of the number of cases and potential deaths as a result of this COVID-19 pandemic. As we saw, we're looking at between 3,000 and 15,000 deaths in Ontario, depending on how we adopt the measures like physical distancing and things like that. Were you shocked by these by these statistics or by these projections, Mr. Mayor?
They are certainly an eye-opener, but not shocking. Having followed the media and reports from around the world very closely, and what's happening, across the U.S. and in Canada and Ontario as well. So, this is a very real threat to health of many people in our community and in the province, so we've been taking it very seriously, and as you said, today was a very busy day, just from meetings to meetings, getting updates, getting advice, connecting with Dr. Sutcliffe essentially on a daily basis, learning of new cases, and getting her advice on how we move forward with all of this. And so, again, I absolutely believe in relying on the expertise of our professionals, the people who have this expertise in our community. I believe that it's working for Sudbury, and yet I think the message that we got from the province today was how incredibly important it is to follow all the directions, because they do believe overall it's working. It's especially important for Sudbury to minimize the number of people that will get sick from COVID, and we're seeing some of those projections, like you said, how many people potentially could die if we didn't follow the directions. So eye opener, and we're taking very seriously. I guess what I'd like to say is that we've implemented every single measure that has been recommended to us by Dr. Sutcliffe, and that's been handed down by the province, and we're following very closely.
Okay. With just the local sort of command table or the local response team, do the members of that team, are you guys speaking on a daily basis?
We're currently meeting between 2 and 3 times a week, and it depends on what's happening that particular day in the events, because as you know, everyone knows quite well, things are changing very, very quickly. And so I also meet with our executive leadership team. I just got off a phone call just prior to this call with the city's executive leadership team. Many of our executive leadership team are also on the community control group. And as I said, speaking to Dr. Sutcliffe, she's part of the community control group, and we've got Chief Pedersen, who's on the community control group, and Dominic Giroux from HSN.
Okay, we learned this week or today rather that today or yesterday that it's so many news stories breaking at the same time that sometimes I have trouble remembering what happened when. But Mayor George Peary in Timmins has declared a state of emergency in that city, and as you know, I'm sure Timmins is the hotspot in the north for cases. They are up to, I think, 28 cases in the Porcupine Health Unit area now. I mean, it's much higher than Sudbury. That is the dominant. That is where we're seeing the most cases in Northern Ontario at the moment, is up around the Timmins and Cochrane area. Now, in response to this, as I said, the mayor there has declared a state of emergency. I was kind of wondering where you were at on this question. Is that, I mean, are we getting close to the point where a state of emergency should be declared in Greater Sudbury?
So I can tell you that absolutely everything is on the table. I'm constantly discussing these types of topics. It was a point that I discussed with Dr. Sutcliffe today. One of the things, anticipating the messaging from the province, hearing the messaging coming out of Toronto, what Dr. Sutcliffe shared with me is, we're not Toronto. We're not Timmins in the Porcupine District. They've got a quarter of the population. And so, absolutely fully respect Mayor Perry's decision to declare a state of emergency today. And yet, I'll tell you that it is absolutely on my mind. It's on the table.
What would it have to take, I guess, for us to reach that threshold where it would go from being simply on your mind to being something that you take action upon?
Well, as I said, we have been doing everything that, based on the advice of Dr. Sutcliffe, and everything that has been ordered or directed or recommended by all of the professionals. And so, not having declared a state of emergency to this point has not restricted our ability to respond. We saw a significant jump in the number of cases today. And if that's clearing up a backlog, that's one thing. If it starts being a trend for a few days in a row, I think at that point in time, I would seriously consider declaring a state of emergency. And the main reasons that we would declare a state of emergency are, opening up the opportunity to very quickly turn to volunteer organizations to provide supports throughout the community. And volunteer organizations are working right now in support of the community, but one of the technical elements is that volunteers would be covered under WSIB. So if we were going to use volunteers to a significant extent, that would definitely trigger that decision. The ability to streamline our decision making and make sure that it is as quick as possible and turn around, trying either to provide resources or funding as things. As you say, the pace is accelerating very quickly, and we are all feeling it. Everyone who's following this very closely, and so if I started seeing those indicators moving in that direction, I believe it's important for us to stay as nimble and as possible to be able to respond to the needs in the community. And so that would be another reason to go in that direction. Okay. If we went beyond that, our number one concern is for the health and safety of people in our community, and for the lives of Sudburyans, trying to save lives here. On the other extent, we're also trying to do whatever we can to minimize the impact of a surge in demand on our medical and healthcare professionals and their capacity to deal with patients. And right now we believe that we're in a fairly good position as far as capacity goes. But as we all know, things are changing so quickly. So capacity would be in the hospital or with public health would be other considerations that I would want to jump in and start putting more city resources to supporting those organizations directly. Okay.
Okay. Sticking with Timmins, in announcing the state of emergency today, Mayor Perry also included, much like Ontario Public Health did today, projections for Timmins on the number of cases they're expecting, the number of cases they're expecting who will require hospitalization, the number of cases who will require being in the intensive care unit. as well as when they think cases are going to peak in Timmins. I was wondering if you are prepared to talk about those similar projections for Greater Sudbury.
So I'm absolutely always prepared to talk about numbers that I would have available to me. At this point in time, I can only I can only surmise that the numbers have been provided to Timmins because of the situation in Timmins. And I believe the numbers are being produced by the province as well. So we saw provincial numbers. Mayor Perry is sharing numbers for his community. I have asked Dr. Sutcliffe this morning, and so we don't have numbers to share for our community, but I would take that as a good sign. The priorities of developing these analyses are based on the conditions in various healthcare, public health districts, and so I'm sure they are in the process of being developed, but we weren't one of the priorities. That tells me that what we've been doing has been working.
Well, let me see if I understand this. We don't know what the local projections are for Sudbury. I mean, how is it possible to plan a response if if we don't understand the full picture of what we could be possibly facing? I'm not quite sure how that works.
Well, I think we have high-level projections that have been prepared by various organizations at this point in time. We can see how this grows and where this ends up when people don't follow the directions and don't self-isolate and follow all of the orders that are coming down from the province at this point in time. So we are tracking absolutely the number of complaints through 311, where we've asked people to call 311, let us know where they see challenges with non-essential businesses being open or people gathering in larger numbers that are not advised, using public facilities that have been closed to the public. And so, those numbers we're monitoring closely. They are still a very, very small percentage of the total number of COVID-related phone calls we're receiving 311. We're also, obviously, we operate, we're, in close connection with the police, with fire, with the paramedics, and so we're monitoring the COVID calls and the paramedic calls
right.
As well. So we have a good view as to where things are moving, and really the direction that's been given. There's, at this point in time, as far as a broad and general request of the public, everybody's fully aware of it, and so monitoring the compliance and any changes is really key for us right now.
Okay. Sorry, I don't mean to come back to those numbers again, but I mean, part of the reason that Premier Doug Ford, wanted those numbers was released was because he wanted people to understand the full picture of what we're potentially facing, particularly people who either think A, this is a hoax, or B, that this is not that big of a deal. Are those numbers that could be that you want to release to the public so that people of Sudbury fully understand what it is that we're facing? I mean, is that something you're going to be doing?
If I had the numbers, I would be releasing them.
Okay.
Absolutely. I do believe the public, as the Premier said, I believe the public has the right to see the numbers, from any projections that might be created for Sudbury. At this point in time, we understand the trend. We know where this goes when people don't, if there's not compliance, and I think Sudbury is still doing okay on the path. Not downplaying where we are, and we've had our people pass away from COVID, or understanding that they had COVID, and there are many people who are hospitalized and concerned. So not downplaying any of that. However, we know where this goes, and it's just a responsible thing to do is to stay at home as much as possible and minimize non-essential trips outside of the home.
Okay. Are you satisfied with the steps that particularly retail locations that are still opening have been doing to both protect their staff but also to minimize the number of people who are in their stores? I mean, are bylaw officers going out and making sure that retail locations are following the directives of the province and minimizing the number of people in stores and that sort of thing?
Well, so obviously we created this opportunity through 311 when the province gave the powers to our bylaw officers to do some enforcement. So we are reliant on information being and concerns being passed on by the public or questions. That said, I from everything I hear, I know that retailers are very, very aware. They're trying to protect their own employees as well as the public, and so there are a variety of methods to go about that, but we are following through when where appropriate and where there's a concern that we can follow through on.
Okay. Have you had to lay any charges or anything?
I'm not aware of us laying any charges at this point.
Have you had to respond to complaints, though? Have bylaw officers had to pay a visit to individuals or businesses and say, "Hey, you're not abiding by what the powers that be are recommending"?
We are responding to the calls on, I believe, yesterday. Keeping my days straight, we had 42 calls that raised some sort of concern related to the provincial orders, and those are passed on to our bylaw section.
Okay. We've heard from some frontline workers at the hospital who say that they're being asked to reuse masks. Are you confident in the amount of personal protective equipment that HSN has access to? Are you confident in the number of ICU beds that we have, the number of ventilators that we have? I mean, I'm sure you've been apprised of what our capacity is. Is it enough?
Well, from that perspective, I rely on conversations and updates that we're receiving from Dominic Giroux. And so, I trust the leadership and I trust the knowledge and the skills and the caring of our frontline workers in the hospitals. I know people who work in the hospital. My wife works in HSN. And so what I would say is that I trust that they've done their very best. We have surge capacity in case we do see a surge in requests, and we're the hospital is organizing extra capacity, as is the city, to deal with the potential of this anticipated surge in the number of cases. And so we've seen that trend in other communities. I think we're well prepared, but it all depends on how people take seriously the need for compliance across the community.
Yeah, are you hearing much about that? Are you hearing of groups of people who are? I mean, my wife just called me this afternoon to with some concerns about groups of people, and have you seen or heard of people who are just either flouting the recommendations or being just disbelieving them and just disbelieving that they're even necessary?
Yeah, so I'm not hearing about widespread abuse of the directions. We did get 42 calls on Thursday, and earlier in the week around 24. But as we go out and we talk to people, they seem to be receptive, and they do say that they understand, and it's the onus on everybody. It's not only and so. I've said this a number of times. It's not only about protecting yourself and you not being worried that you're going to get COVID or that you're going to do okay when you get COVID. It's the concern that people can be asymptomatic. They can have no symptoms and unknowingly spread the virus to others who are more vulnerable in the community. And so what the Premier said today, I think, is bang on. It's not worth, in his words, not worth having a beer in your basement with a bunch of your buddies, thinking nobody knows, it's not worth a life, not one life. And so people do need to take this seriously.
Okay. Just to some more, just to some questions we received from the public that they're still curious about it. I mean, it's somewhat related to COVID, but not quite so pressing, perhaps. Guelph has laid off 600 of its part-time and seasonal workers. I asked you about layoffs last time. I was wondering if this is is this a step that Sudbury is going to be taking in terms of seasonal and part-timers? And are there still plans to keep the full complement of city staff working through this, or has that situation changed?
Well, what I can say is we are doing everything we can to keep people working. We've been redeploying certain personnel. A lot of our workers, the last number I heard, we had 500 people working from home through technology. And so that's been our focus. It takes a lot of resources to keep the city of Greater Sudbury running. We're providing essential services, whether it's police or fire or paramedics or clean drinking water or keeping your sewers, the wastewater running. All of those things are quite important to the community, as well as road repairs. And so, there are many jobs that we're continuing on, and we are going to do our very best to keep as many people employed and productive, because the city does need to run, and citizens do rely on the services that we provide.
Okay. Transit, are there going to be? We're here. I mean, I know transit's still operating. It's important that we keep providing an ability for people to move around the city. But I'm hearing that there isn't a lot of people using transit at the moment. That a lot of buses are running empty or with minimal numbers of people on them. Are there any plans in the works to reduce routes or anything like that, or is everything going to be status quo throughout this?
So obviously, we've been talking about transit. We're fully aware of the ridership numbers. Part of the rationale in keeping the transit route running was to get a good understanding of ridership, not only during the March break. And so we're seeing, more of a whatever the new norm is of a work week at this point in time. So it truly is a new norm. And so I've requested a report from Steve Jakes, who is our general manager of community development and oversees transit. And so they will bring proposals to myself and to council, I expect, on proposed changes to, the challenge is, and I really want to make sure that we don't leave people stranded. As much as possible, we minimize the case where people who absolutely rely on the transit system don't have the opportunity to, earn some sort of income, get to healthcare, do what they need to do, shop for groceries. So there are many people who rely on transit services, and so. That's also a significant thought in the back of our minds, but staff will come back with proposals, and it might be the frequency of bus routes and looking at some of the less used bus routes. But we'll see that report coming back and decisions made in the near future.
Okay. When you're doing this planning, how many months out are you kind of working on the assumption that this is going to be in place for?
Well, right now we're just following, really the indicators that we're seeing from the province and the federal government, and so those numbers, as with that question, those numbers and those dates are changing constantly. So what we've committed, in a lot of the decisions we've made is initially when we decided to defer interest on accounts receivable and penalties on our accounts receivable for taxes and for water and wastewater bills and such. We said we're going to defer them to pick a date, June 4th, because that was our next billing date for taxes. And that means that we would intend to have a council meeting well enough in advance of June 4th to inform people what our decision is. If in the midst of it, obviously we would, the decision would likely be to continue to defer and keep money in people's pockets in the bank accounts. So, we're trying to be supportive that way. That is the intention, and so it's really hard to predict. It could be a long haul. As some of the predictions are out there, and we're also being encouraged to say, with greater and stronger compliance in some areas, it may mean a shorter, isolation period and a quicker path to, getting back to whatever the new normal will be in economic prosperity and recovery.
Okay. Now, of course, one last question, Mr. Mayor. The Premier today shut down all construction projects unless there's sort of necessary projects. He gave the examples of transportation projects and healthcare hospital type of projects. Does that order from the Premier have a big impact economically in Sudbury? Were there a lot of construction projects ongoing at the moment that had to be stopped?
It tends to put our large projects like the event center, art gallery, on the line. We understand, what's happening on the other end of this. However, we're working on our roads. We've been out and tendering contracts to keep construction companies, local companies working where they have the workers and bidding on these contracts. We will make sure that they're working in a safe manner, and we'll continue to follow the orders from the province. So having information at exactly the same time as you, that's why I got off the call with our executive leadership team. One of the questions is okay, so what does this mean to our operations? How does this affect our capital plan and our capital works moving forward? I'll remind everyone that we do have a city council meeting on Tuesday, and so I do expect an update on our operations at that council meeting on Tuesday evening, and so by then we'll have it very clear and clearly defined for everybody on council and organization, and for the businesses and contractors that are interested in still continuing the construction within the city.
Okay, well, thank Mr. Mayor. If there's nothing else, I'll let you get back to work.
Okay.
I appreciate.
Thank you very much, Mark. Much appreciated.
Thanks for joining us again, Mr. Mayor. Thanks for the update. We probably will likely want to do this again with you if you can make yourself available to, just to provide an update to the local situation in Sudbury. It's helpful for people, I think.
I'm very pleased to share any information I have and all the things we're working on. What I can say is that it's been an incredibly busy week. Things seem to be accelerating. A lot of decisions, a lot of media reporting and updates to go over and consider from our city's perspective. All I can do is say that there are very long days, but we're doing the work that people expect us to do. When we were elected to represent them, and it is all about Sudbury's and district. From that public health perspective, as mayor of City of Greater Sudbury, it's about City of Greater Sudbury as well as people in the outlying areas that we're doing our very best. We're careful to implement all of the protocols and all of the orders that are given by the various levels, stay on top of all of the issues, and so that keeps me busy as well as all the media. But I appreciate the opportunity to speak to the public and give them updates so they understand there's a lot of decisions happening and things that we're improving on even on a day.
Okay.
Thank you.
Thank you
Okay.
very much for your time. And readers, for all of your local, national, and provincial COVID-19 news, head to Sudbury.com. We're updated every hour with something new for you to read and to something new for you to learn. For all of us here at Sudbury.com, I'm Mark Gentili. Thanks for joining us.